Hello everyone, I'm Shraddha Methani. I'm a fifth year medical student and I'm going to be talking about endocrine system part 2, and we're mainly focusing on adrenal cortex and medulla and endocrine pancreas. Today we'll be talking about adrenal gland, anatomy of the adrenal gland, hormones of the adrenal gland disorders, diagnosis, treatment, complication, acute adrenal crisis, prevention, adrenal cancers, and the conclusion of pathology of adrenal gland and also pathology of endocrine pancreas. So, what is adrenal gland? Adrenal glands, also known as suprarenal glands, are small triangular shaped glands located on the top of both kidneys. Adrenal glands produce hormones that help regulate your metabolism, immune system, blood pressure, response to stress, and other essential functions. Adrenal glands are composed of two parts, the cortex and the medulla, which are each responsible for producing different hormones. Here is a picture of both adrenal glands, and they're basically located on the top of both kidneys. So, the anatomy of adrenal glands. An adrenal gland is made of two main parts. The adrenal cortex is the outer region and also the largest part of an adrenal gland. It is divided into three separate zones, that is, zona glomerulosa, zona fasciculata, and zona reticularis. Each zone is responsible for producing specific hormones. The adrenal medulla is located inside the adrenal cortex in the center of an adrenal gland. It produces stress hormones, including adrenaline. The adrenal cortex and adrenal medulla are enveloped in an adipose capsule that forms a protective layer around an adrenal gland. Here's a picture of adrenal gland. So we can see a capsule. Under it, we have cortex, which have three different zones as we mentioned above. Then there's medulla, and there are multiple blood vessels in the medulla. This is another picture where we can see histology of the capsule, zona glomerulosa, zona fasciculata, zona reticularis, and then chromaffin cells which are present in the medulla. Now we'll be talking about the hormones of the adrenal glands. So the role of the adrenal glands in your body is to release certain hormones directly into the bloodstream. Many of these hormones have to do with how the body responds to stress, and some are vital to existence. Both parts of the adrenal glands, the adrenal cortex and the adrenal medulla, perform distinct and separate functions. Each zone of the adrenal cortex secretes a specific hormone. The key hormones produced by the adrenal cortex include cortisol. So, cortisol is a glucocorticoid hormone. It is produced by the zona fasciculata that plays several important roles in the body. It helps control the body's use of fats, proteins, and carbohydrates. It suppresses inflammation, regulates blood pressure, increases blood sugar, and can also decrease bone formation. This hormone also controls sleep-wake cycle. It is released during times of stress to help your body get an energy boost and better handle an emergency situation. How adrenal glands work to produce cortisol. So, adrenal glands produce hormones in response to signals from the pituitary gland in the brain, which reacts to signaling from the hypothalamus, also located in the brain. This is referred to as the hypothalamic pituitary adrenal axis. As an example, for the adrenal gland to produce cortisol, the following occurs. So, the hypothalamus produces corticotropin releasing hormone that stimulates the pituitary gland to secrete adenocorticotropin hormone. Now, this ACTH then stimulates the adrenal glands to make and release cortisol hormones into the blood. Normally, both the hypothalamus and the pituitary glands can sense whether the blood has the appropriate amount of cortisol circulating. If there is too much or too little cortisol, these glands respectively change the amount of CRH and ACTH that gets released. This is referred to as a negative feedback loop. Excess cortisol production can occur from nodules in the adrenal gland or excess production of ACTH from a tumor in the pituitary gland or other source. The second hormone is aldosterone. This mineralocorticoid hormone, produced by the zona glomerulosa, plays a central role in regulating blood pressure and certain electrolytes like sodium and potassium. Aldosterone sends signals to the kidneys, resulting in the kidneys absorbing more sodium into the bloodstream and releasing potassium into the urine. This means that aldosterone also helps to regulate the blood pH by controlling the levels of electrolytes in the blood. The third hormones that we're going to talk about are DHEA and androgenic steroids. So these hormones produced by the zona reticularis are weak male hormones. They are precursor hormones that are converted in the ovaries into female hormones, that is estrogens, and in the testes into male hormones, that is androgens. However, estrogens and androgens are produced in much larger amounts by the ovaries and testes itself. The fourth hormones that is produced by the medulla are epinephrine, that is adrenaline, and norepinephrine, noradrenaline. So the adrenal medulla, the inner part of an adrenal gland, controls hormones that initiate the fight or flight response. The main hormones secreted by the adrenal medulla include epinephrine, that is adrenaline, and norepinephrine, that is noradrenaline, which have similar function. Among other things, these hormones are capable of increasing the heart rate and force of heart contractions, increasing blood flow to the muscles and brain, relaxing airway smooth muscles, and assisting in glucose, that is sugar, metabolism. They also control the squeezing of the blood vessels, that is vasoconstriction, helping maintain blood pressure and increasing it in response to stress. Like several other hormones produced by the adrenal glands, epinephrine and norepinephrine are often activated in physically and emotionally stressful situations when your body needs additional resources and energy to endure an unusual strain. Now, this is adrenal gland and the hormones produced by each layer. So there's aldosterone, cortisol, epinephrine, and androgens. So we can see aldosterone, it has main effect on kidneys. Cortisol, it has main effect on liver. Epinephrine, it affects liver, heart, and muscles. And androgens, which affect male sex organs and female sex organs. Now we'll talk about adrenal gland disorders. So the two common ways in which adrenal glands cause health issues are by producing either too little or too much certain hormones, which leads to hormonal imbalances. These abnormalities of the adrenal function can be caused by various diseases of the adrenal glands or the pituitary gland. Too much or too little of the adrenal hormones can lead to a group of disorders known as adrenal gland disorders. So these conditions are unique to the hormones affected, impacting the healthy and normal functioning of the body. Why do adrenal disorders occur? So the causes of adrenal disorders include malfunctioning of the pituitary gland, which leads to inability of the pituitary gland to instruct and control the adrenal gland. Second reason can be tumors in the adrenal gland, infections in the adrenal gland, impact of certain medications or steroids, and genetic factors leading to improper adrenal gland functioning. Symptoms of adrenal gland disorders. So, although each condition may have its unique symptom, the common adrenal disorder symptoms include dizziness, excessive tiredness, sweating, nausea and vomiting, increased salt cravings, low blood sugar, low blood pressure, irregular periods in females, dark patches on her skin, muscle and joint pain, loss of appetite. These symptoms are known to be mild and rare at first, and over time become recurring and even worse. Hence, it is essential to consult a healthcare practitioner regarding the symptoms of adrenal disorders. So, now we're going to talk about different disorders which are caused due to adrenal gland excess or too little. So, here we're going to talk about Addison's disease. So adrenal glands in Addison's disease, they do not produce sufficient steroid hormones. So they can lead to different symptoms. For example, in skin, it can lead to hyperpigmentation, low blood pressure, weakness, weight loss. In GI system, it can cause nausea, diarrhea, vomiting, constipation, abdominal pain, and it can also lead to vitiligo. So the types of adrenal gland disorders. The improper production of each hormone produced by the adrenal gland can lead to a specific type of disorder with a particular underlying cause. The most common types of adrenal gland disorders include adrenal insufficiency, overactive adrenal glands, excess of cortisol, Cushing syndrome, excess of aldosterone, hyperaldosterone, excess of adrenaline or noradrenaline, that is pheochromocytoma. So now we're going to talk about adrenal insufficiency. Adrenal insufficiency is a rare disorder. It may be caused by disease of the adrenal glands, primary adrenal insufficiency, Addison's disease, or by diseases in the hypothalamus or the pituitary, that is secondary adrenal insufficiency. It is the opposite of Cushing syndrome and is characterized by low levels of adrenaline hormones. The symptoms include weight loss, poor appetite, nausea, vomiting, fatigue, darkening of skin, only in primary adrenal insufficiency, and abdominal pain, among others. The causes of primary adrenal insufficiency may include autoimmune disorders, fungal and other infections, cancer, and genetic factors. Although adrenal insufficiency usually develops over time, it can also appear suddenly as an acute adrenal failure, that is, adrenal crisis. It has similar symptoms, but the consequences are more serious, including life threatening shock, seizures, and coma. These may develop if the condition is left untreated. The second disorder we're going to talk about is overactive adrenal glands. So sometimes adrenal glands may develop nodules that produce too much of certain hormones. So nodules are like 4 centimeters or larger, and nodules that show certain features on imaging increase suspicion for malignancy. Both benign and cancerous nodules may produce excessive amounts of certain hormones, which is referred to as a functional nodule. Functional tumors, malignant tumors, or nodules greater than 4 centimeters are recommended to be referred for surgical evaluation. Excess of cortisol, that is Cushing syndrome. So Cushing syndrome results from excessive production of cortisol from the adrenal glands. The symptoms may include weight gain, fatty deposits in certain areas of the body, such as the face, below the back of neck called a buffalo hump, and in the abdomen. Thinning arms and legs, purple stretch marks on the abdomen, facial hair, fatigue, muscle weakness, easily bruised skin, high blood pressure, diabetes, and other health issues. Excess cortisol production can also be triggered by overproduction of ACTH by a benign tumor in the pituitary gland or tumors elsewhere in the body. This is known as Cushing disease. Another common cause of Cushing syndrome is excessive and prolonged consumption of external steroids such as prednisone or dexamethasone, which are prescribed to treat many autoimmune or inflammatory diseases. For example, lupus, rheumatoid arthritis, asthma, inflammatory bowel disease, multiple sclerosis, etc. Excess of aldosterone, which is also known as hyperaldosteronism. Hyperaldosteronism results from overproduction of aldosterone from one or both adrenal glands. This is characterized by increase in blood pressure that often requires many medications to control. Some people can develop low potassium levels in the blood, which can cause muscle aches, weakness, and spasms. When the cause is adrenal oversecretion, the disease is called Conn syndrome. Excess of adrenaline or noradrenaline, that is pheochromocytoma. Pheochromocytoma is a tumor that results in excess production of adrenaline or noradrenaline by an adrenaline medulla that often happens in bursts. Occasionally, neural crest tissue, which has similar tissue to the adrenal medulla, may be the cause of overproduction of these hormones. This is known as paraganglioma. Pheochromocytomas may cause persistent or sporadic high blood pressure that may be difficult to control with regular medications. Other symptoms include headaches, sweating, tumors, anxiety, and rapid heartbeat. Some people are genetically predisposed to developing this type of tumor. How to diagnose adrenal disorders? So, along with a detailed medical history and a thorough clinical examination, clinicians call for blood tests, urine tests, and imaging tests to diagnose adrenal disorders. Blood and urine tests, these tests to measure and evaluate the level of adrenal hormones as well as pituitary hormones. They also help assess blood glucose levels and sodium levels. For imaging tests, we use ultrasound, CT, MRI, and X-ray imaging take pictures of the adrenal gland. They help detect possible tumors, impact on the gland, and other signs of disease. Now, we're coming to the treatment. So, how to treat adrenal gland disorders? So, the treatment of adrenal disorders is generally associated with the cause of the disease and aimed at normalizing the adrenal hormone levels in the body. Medication therapy. Commonly, low adrenal function conditions like Addison's disease is treated with hormone replacement therapy to increase and normalize the hormone levels in the body. Moreover, medications help decrease cortisol production in the adrenal glands or inhibit the influence of cortisol in conditions like Cushing's syndrome. Surgical interventions help in removal of the tumor. However, they depend on the type, size, and extent of the tumor. Sometimes, surgeries are performed when other treatment options fail to show results. Other treatment options include radiation therapy and chemotherapy. Based on the underlying cause, there are also combinations of the above treatments tried by doctors depending on the condition. Also, medications may help control symptoms such as high blood pressure and fatigue. During treatment, other organs such as pancreas, sex organs, thyroid organs, and pituitary gland may be evaluated to look for the impact of the improper functioning of the adrenal gland on them. Complications of adrenal disorders. So, adrenal disorders may harm the overall healthy functioning of the body. These primarily include muscle weakness, behavioral disturbances such as emotional liability and sometimes depression, and also adrenal crisis. Acute adrenal crisis. So, acute adrenal crisis is a potentially life-threatening medical emergency. It occurs due to an extreme shortage or insufficiency of the cortisol hormone. The cause of the adrenal crisis can be any of the following. That is, presence of an adrenal gland disorder or malfunction such as Addison's disease or CAH, improper functioning of the pituitary gland leading to inactivation of the adrenal gland, change in medications or their dose, dehydration, stress, infections. It exhibits symptoms such as abdominal pain, dizziness, loss of consciousness, fatigue, headache, high fever, loss of appetite, nausea, vomiting, excessive perspiration, etc., among the others. It is essential to recognize these symptoms and seek immediate medical attention to avoid delay of treatment. Potential complications include shock, coma, and seizures. Prevention. People with Addison's disease should be trained to recognize signs of stress that may cause acute adrenal crisis. In most cases, a patient might need to self-medicate with prescribed medication in times of stress. Patients suffering from Addison's disease are always recommended to carry their medical card with details and dose of medication needed in case of emergency. Now let's talk about adrenal cancers. Adrenal cancers are rare but aggressive cancers of the adrenal gland, leading to excessive production of all the adrenal hormones. So, primary adrenal cancers, they begin from within the adrenal gland, that is, the cortex or the medulla itself. They tend to spread to other organs and cause grave changes within the body. Whereas secondary adrenal cancers, they arise from different parts of the body, such as the lungs, breast and colon, rectum, etc., and spread to the adrenal gland. They are said to be more common than the primary variant. The sign and symptoms of adrenal cancer may vary depending upon its impact on the hormones, size of the tumor, and extent of spread of cancer. Risk factors for adrenal cancer. There is no single cause for the occurrence of adrenal cancers. It is primarily attributed to a genetic abnormality. Women have a slightly higher risk than men in developing adrenal gland cancer. How to diagnose adrenal cancer? So, the objective of diagnosis is to identify improper levels of adrenal hormones and identify structural abnormalities. Hence, along with a comprehensive history and physical examination, clinicians call for blood tests, urine tests, and imaging tests such as X rays, CT, MRI, ultrasound, and PET scans. Along with this, adrenal cancers may have a more comprehensive testing process to arrive at a diagnosis. Doctors may suggest a collection of biopsy with the help of a needle called a fine needle biopsy. These samples are studied under a microscope to indicate the type, nature, grade, and extent of cancer. Grade and stage adrenal cancers. So, the grade is a description of how the cancer cell looks compared to healthy cells. Staging of cancers helps identify the extent of cancer spread in the body. Now, the table below contains the grading and staging of cancers. Grading of cancers. They can be high grade or low grade cancers. In low grade cancers, the cells appear normal, they grow and spread at a slow rate. Whereas in high grade cancers, the cells appear abnormal, they grow and spread at a rapid rate. And staging of cancers. In stage 1, the cancer is smaller than 5 cm. It is limited within the adrenal gland. In stage 2, the tumor is smaller than 5 cm. It is limited within the adrenal gland. In stage 3, the tumor spread to nearby organs, for example, kidney, lymph nodes, etc. And in stage 4, it spread to distant organs like bone, lungs, etc. Prognosis of adrenal cancers. The prognosis of the adrenal cancers is generally dependent on the stage, type, and grade of cancer. A lower stage, functional type, and lower grade of cancer have more favorable results. Unfortunately, due to the varied and delayed nature of the symptom manifestation, adrenal cancers are generally said to be detected at the later stages of the disease. Owing to the delay, they commonly invade nearby organs or spread to distant organs, making it more challenging to treat, impacting the prognosis of the disease. How to treat adrenal cancer? Treatment of adrenal cancer usually includes any one or more of the following. It can be surgery, supportive medications, chemotherapy, or radiotherapy. Surgery. The type of surgery is decided upon the size of the tumor and also where cancer has spread. For example, adrenalectomy is a surgery to remove the entire adrenal gland. It is preferred when the cancer is localized in an adrenal gland. Supportive medications. These medications are usually prescribed to control symptoms occurring as a result of too much hormone production or low hormone production post-surgery. Chemotherapy, usually used in patients where cancer cannot be removed with surgery. It is also given in addition to surgery in some patients. Radiotherapy. In this therapy, external beam radiation therapy may be given after surgery in some to reduce the risk of cancer coming back. Next up, we have pathology of endocrine pancreas. So, what is pancreas? Pancreas is a long, slender organ most of which is located posterior to the bottom half of the stomach. Although it is primarily an exocrine gland, secreting a variety of digestive enzymes, the pancreas has an endocrine function too. Its pancreatic islets, that is, cluster of cells formerly known as the islets of Langerhans, secrete the hormones glucagon, insulin, somatostatin, and pancreatic polypeptide. Here's a picture of pancreas, and we can see the pancreatic islet, which consists of mainly alpha cells, beta cells, and exocrine acinus. The pancreatic hormones are mainly insulin and glucagon, which are taken up by the arteries and released in the bloodstream. Let's talk about cells and secretions of the pancreatic islets. The alpha cell, they produce the hormone glucagon and make up approximately 20% of each islet. Glucagon plays an important role in blood glucose regulation. Low blood glucose levels stimulate its release. The beta cell, they produce the hormone insulin and makes up approximately 75% of each islet. Elevated blood glucose levels stimulate the release of insulin. The delta cell accounts for 4% of the islet cells and secretes the peptide hormone somatostatin. Somatostatin is also released by the hypothalamus as growth hormone inhibitor hormone, and the stomach and intestines also secrete it. An inhibiting hormone, pancreatic somatostatin, inhibits the release of both glucagon and insulin. The PP cells, that is pancreatic polypeptide cell, accounts for about 1% of islet cells and secretes the pancreatic polypeptide hormone. It is thought to play a role in appetite, as well as in the regulation of pancreatic exocrine and endocrine secretions. Pancreatic polypeptide released following a meal may reduce further food consumption. However, it is also released in response to fasting. Regulation of blood glucose levels. So, glucose is required for cellular respiration and is the preferred fuel for all body cells. The body derives glucose from the breakdown of carbohydrate containing foods and drinks we consume. Glucose, not immediately taken up by the cells for fuel, can be stored by the liver and muscles as glycogen or converted to triglycerides and stored in the adipose tissue. Hormones regulate both the storage and the utilization of glucose as required. Receptors located in the pancreas sense blood glucose levels, and subsequently the pancreatic cells secrete glucagon or insulin to maintain normal levels. Let's talk about glucagon now. Receptors in the pancreas can sense the decline in blood glucose levels, such as during periods of fasting or during prolonged labor or exercise. In response, the alpha cells of the pancreas secrete the hormone glucagon, which has several effects, which are it stimulates the liver to convert its stores of glycogen back into glucose. This response is known as glycogenolysis. The glucose is then released into the circulation for use by body cells. It stimulates the liver to take up amino acids from the blood and convert them into glucose. This response is known as gluconeogenesis. It stimulates lipolysis, the breakdown of the stored triglycerides into free fatty acids and glycerol. Some of the free glycerol released into the bloodstream travels to the liver, which converts it into glucose. This is also a form of gluconeogenesis. These actions increase blood glucose levels. The activity of glucagon is regulated through a negative feedback mechanism. Rising blood sugar levels inhibit further glucagon production and secretion. Next, we have insulin. The primary function of insulin is to facilitate the uptake of glucose into body cells. Red blood cells, as well as cells of the brain, liver, kidneys, and the lining of the small intestine, do not have insulin receptors on their cell membranes and do not require insulin for glucose uptake. Although all other body cells do require insulin if they are to take glucose from the bloodstream, skeletal muscle cells and adipose cells are the primary targets of insulin. The presence of food in the intestine triggers the release of gastrointestinal tract hormones such as glucose dependent insulinotropic peptide, which was previously known as gastric inhibitory peptide. This is in turn the initial trigger for insulin production and secretion by the beta cells of the pancreas. Once neutral absorption occurs, the resulting surge in blood glucose levels further stimulates insulin secretion. Insulin appears to activate a tyrosine kinase receptor, triggering the phosphorylation of many substrates within the cell. These multiple biochemical reactions converge to support the movement of intracellular vesicles containing facilitative glucose transporters to the cell membrane. In the absence of insulin, these transport proteins are normally recycled slowly between the cell membrane and the cell interior. Insulin triggers the rapid movement of a pool of glucose transporters vesicles to the cell membrane, where they fuse and expose the glucose transporters to the extracellular fluid. The transporters then move glucose by facilitated diffusion into the cell interior. Here's a picture which is easily describing whatever we have mentioned in the above two slides. So we have our pancreas which secretes insulin which will stimulate the formation of glycogen in the liver. Insulin also stimulates glucose uptake from blood into the tissue cells like of skeletal muscles, kidney, fat. This will lead to lower blood sugar. Now, because of this low blood sugar, it will promote glucagon release from the pancreas. Now, once the glucagon is released, it will stimulate the breakdown of glycogen in the liver. This will lead to increased blood sugar. Now, this high blood sugar will promote insulin release and the cycle goes on. Now let's talk about the disorders of the endocrine system, or that is endocrine pancreas. The main disorder we have here is diabetes mellitus. Diabetes mellitus, it is the dysfunction of insulin production and secretion as well as the target cell's responsiveness to insulin. It can lead to a condition called diabetes mellitus. An increasingly common disease, diabetes mellitus has been diagnosed in more than 18 million adults in the United States. So there are two main forms of diabetes mellitus. We have type 1 and type 2. In type 1 diabetes, it is an autoimmune disease affecting the beta cells of the pancreas. Certain genes are recognized to increase susceptibility. The beta cells of people with type 1 diabetes do not produce insulin. Thus, synthetic insulin must be administered by injection or infusion. This form of diabetes accounts for less than 5% of all diabetes cases. Type 2 diabetes, it accounts for approximately 95% of all cases. It is acquired and lifestyle factors such as poor diet, inactivity, and the presence of prediabetes greatly increase a person's risk. About 80 to 90% of people with type 2 diabetes are overweight or obese. In type 2 diabetes, cells become resistant to the effects of insulin. In response, the pancreas increases its insulin secretion, but over time, the beta cells become exhausted. In many cases, type 2 diabetes can be reversed by moderate weight loss, regular physical activity, and consumption of a healthy diet. However, if blood glucose levels cannot be controlled, the diabetic will eventually require insulin. Two of the early manifestations of diabetes are excessive urination and excessive thirst. They demonstrate how the out of control levels of glucose in the blood affect kidney function. The kidneys are responsible for filtering glucose from the blood. Excessive blood glucose draws water into the urine and as a result, the person eliminates an abnormally large quantity of sweet urine. The use of body water to dilute the urine leaves the body dehydrated, and so the person is unusually and continually thirsty. The person may also experience persistent hunger because the body cells are unable to access the glucose in the bloodstream. Over time, persistently high levels of glucose in the blood injure tissues throughout the body, especially those of the blood vessels and nerves. Inflammation and injury of the lining of arteries lead to atherosclerosis and an increased risk of heart attack and stroke. Damage to the microscopic blood vessels of the kidney impairs kidney function and can lead to kidney failure. Damage to blood vessels that serve the eyes can lead to blindness. Blood vessels damage also reduces circulation to the limbs, whereas nerve damage leads to loss of sensation, called neuropathy, particularly in the hands and feet. Together, these changes increase the risk of injury, infection, and tissue death, that is, necrosis, contributing to a high rate of toe, foot, and lower leg amputations in people with diabetes. Uncontrolled diabetes can also lead to a dangerous form of metabolic acidosis called ketoacidosis. Deprived of glucose, cells increasingly rely on fat stores for fuel. However, in a glucose deficient state, the liver is forced to use an alternative lipid metabolism pathway that results in the increased production of ketone bodies or ketones, which are acidic. The buildup of ketones in the blood causes ketoacidosis, which, if left untreated, may lead to a life threatening diabetic coma. Together, these complications make diabetes the seventh leading cause of death in the United States. Diabetes is diagnosed when lab tests reveal that blood glucose levels are higher than normal, a condition called hyperglycemia. The treatment of diabetes depends on the type, the severity of the condition, and the ability of the patient to make lifestyle changes. As noted earlier, moderate weight loss, regular physical activity, and consumption of a healthful diet can reduce blood glucose levels. Some patients with type 2 diabetes may be unable to control their disease with these lifestyle changes and will require medication. Historically, the first-line treatment of type 2 diabetes was insulin. Research advances have resulted in alternative options, including medications that enhance pancreatic function. In conclusion, the pancreas has both exocrine and endocrine functions. The pancreatic islet cell types include alpha cells, which produce glucagon, beta cells, which produce insulin, delta cells, which produce somatostatin, and PP cells, which produce pancreatic polypeptide. Insulin and glucagon are involved in the regulation of glucose metabolism. Insulin is produced by beta cells in response to high blood glucose levels. It enhances glucose uptake and utilization by target cells, as well as the storage of excess glucose for later use. Dysfunction of the production of insulin or target cell resistance to the effects of insulin causes diabetes mellitus, a disorder characterized by high blood glucose levels. The hormone glucagon is produced and secreted by the alpha cells of the pancreas in response to low blood glucose levels. Glucagon stimulates the mechanism that increases blood glucose levels, such as catabolism of glycogen into glucose. Thank you.